Hi Trevor. If you're watching this video, it means that I made it to my trip to Alaska. So sorry I cannot be there with you right now. But anyway, thank you for sharing your slides. I think they're very interesting and I have actually learned from them. So as you commented in your presentation, conventional psychiatry is very limited when helping patients with a challenge that we can barely integrate ourselves. Death anxiety, existential anxiety. Can we integrate that ourselves as providers? That's a question for each one of ourselves to ask. I think what it was helpful, what I can speak for is my experience working in Sloan Kettering for 1 year and also seeing patients with cancer or transplant, where I worked for 5 years in a transplant unit. I think what is helpful is in palliative care settings or people who are experiencing existential anxiety is to explore with the patient the narratives of their own lives. You know, people love and enjoy, and also it has an anti-anxiety effect or a calming effect. And in my opinion, it alleviates the existential anxiety to review your childhood and review your adolescence, marriage, family, children. And also as therapists, we can help correct some cognitive distortions about feelings of shame or guilt about things that happened in the past. At the same time, we can help them with legacy and acknowledge all the good things that happen and how they have contributed to their children and their families and how they can still continue to contribute. I think it's helpful to explore the ways of transcendence that people have. We all have different ways of transcendence. Some people nowadays like to follow Eastern meditation and religion. Others follow spirituality, connection with nature, philosophy, religions, even connected. You don't have to be religious to connect with your religious culture or your religious background. And that way you can feel connected to your roots. You can feel connected to your ancestors. And those are kind of like, in my opinion, ways of feeling that you can connect with transcend and feeling more connected. I think feeling connected is something that helps, not only with the people that are here with us, but also with our parents, our grandparents, our culture, our people. So I think that can help alleviate this kind of existential anxiety that you're talking about, which is a problem that we don't even understand very well, you know, like many other things. And we can, like I said, cannot integrate that well as providers. So how are we helping with people with something we cannot understand? I think psychiatrists are the ideal people to do with that, because that's what we do all the time as psychiatrists, try to help people with problems that we have difficulty understanding. But this one reaches a higher level. And for that, we had to be very, very creative. I think for me, when people ask me, what do you do there when you were working there, or what do you do when you're treating these patients, the only thing I feel I can be useful for is to be a witness. I think I can accompany these people, I can give them company, I can be there with them, and I'm a vehicle of acknowledgement of their changes that they are going through. People are changing a lot, and sometimes these changes are not being acknowledged because sometimes it's difficult for the family to be there and be connected, but every situation is different. But for me, being a witness and to be like the vehicle that could acknowledge these changes, that's how I felt the most useful. So on that note, congratulations on this work and keep going with the good work. Bye-bye.